Hello, everyone. Thank you so much for coming on to Dismantling the Status Quo, HIV and AIDS in the SDA, Sex and HIV AIDS in the SDA Church. I am your hostess, Jalecia Scott, for the evening. And we will be talking on so many different topics, from what is sex to what is HIV AIDS, to realizing to looking at what the church's their engagement in the history of HIV/AIDS, and then what we can do going on from there. We have so much jam-packed for you guys, and we cannot wait to begin. But before we begin, I will be introducing our lovely panelists, or some of the people that you will see in our webinar today. So today I have the pleasure of introducing our guest speakers, Carrie Goodman, who is the program consultant for Balm In Gilead Incorporated, Zachary Frost, who is our allergy and immunology community outreach specialist of Northwell Health, Corey Chisholm, our spokesperson from the New York State Health Department's HIV Stops With Me campaign, and we have the co-president of Stony Brook University's Our Foundation AYM on as well, Rose Merlene and Rashawn Davis. We also have representative of the non-denominational Christian, we have a representative from the non-denominational Christian population, Desmond Jenkins Sierra, and our lovely pastors, Pastor George and Pastor Neville Lendor. And so these are some of the speakers that you will be seeing in today's webinar. We hope that you will be blessed and that you will learn so much more about the church's stance on sex and HIV/AIDS. So before we just jump into our presentations or what we have lined up for you, I will ask for our pastor of Amazing Grace SDA, for Pastor Neville Landor, to come on and give us our opening prayer.
Good afternoon. Thank you so much, Jalecia. So glad to be a part of this service and educate not only our people, but also making sure that we educate our community on sex and HIV. Let us bow our heads in prayer. Our Father and our God, we just want to thank you for who you are. Thank you for being our creator and allowing us to know that we are loved as you're created. God, today we just want to take on a few challenges where we're going to embark on talking on things that are not talked about much in the church. And so, God, as we have our panelists who are here to enlighten us, to encourage us, and to educate us, we pray that this presentation will go off without a hitch and that all will go well. Have your way with us, oh God. In Jesus' name we pray. Amen.
Amen. So we will first go into the first part of our webinar. I will introduce once again Pastor George of Amazing Grace SDA. He will be presenting on what is sex. But before he goes on, I will ask for one of our members of the Amazing Grace Youth Department, for Reagan Harrison, to come on and present to us our foundings from a pre-survey that we did when we gave out the information for this webinar. We collected some survey responses from our viewers on what they know. We just want to know their knowledge of what they know on HIV/AIDS. And I will now pass over the torch to Reagan Harrison.
I hope that you are having a good time so far, and I'm so glad that you are here. So I'm just going to do a short overview of some of the pre-survey results for this event. We created a survey with about 6 questions regarding information around how people contract HIV, and other relevant questions that will thankfully be answered and discussed by many of our speakers today. This pre-survey report has had about 6 questions, as I said before. The respondents to the report were primarily women, They were Black and African American, and they were between the ages of 18 and 44, while there were some over the age of 55. Can you go to the next slide? The next one, yes. So the first question was true or false. HIV or AIDS is a chronic infectious disease with no known cure. And so 80% of respondents said true, 20% said false. Can you go to the next slide? Yes, so that was just a representation of the data. You can go to the next question. The second question was true or false, anyone can become HIV positive and or acquire AIDS. And 100% of people said true, that anyone can become HIV positive or acquire AIDS. Okay, next question. So we asked also, how can you determine that you've become HIV positive? And we gave a couple of options for people to look at. Taking a test, which would mean going to a clinic or your nearest medical provider when you find red bumps around your genitalia, having a fever, experiencing itching and burning sensations. So 93% of people said that you would have to take a test, go to a clinic or a medical provider to determine whether you've become HIV positive, while 6%, around 6.5% of people said you having a fever would be, a determining factor for whether or not you've contracted HIV. Next question. Check all that apply. How is HIV transmitted from person to person? So there are a range of answers here. And a lot of people, chose the first option, anal and vaginal sex. That was 29% of people. Oral sex, that was 27% of people. Through injection, drug use, kissing an HIV positive person, coming in contact with tears and or sweat of an HIV positive person, through mosquito bites, breathing in air that contains the virus, didn't have any responses. So those were all that were checked, that were applied, that people thought applied to the question, and hopefully we'll clear up some of those misconceptions during our presentations. The next question asks, what mucous membranes or bodily fluids transmit HIV? And so there were, again, a range of answers: blood, semen, pre-seminal fluids, vaginal distribution, breast milk, rectal fluids, saliva. So most people chose within the first four options: blood, semen, pre-seminal fluids, vaginal distribution. And there were some people who also said rectal fluids. The others, not so much. You can go to the next. So the next question we asked was, how can I prevent myself from contracting HIV? And people were asked to check all that apply. Practicing abstinence was 40%, as well as using contraceptives like male and female condoms correctly. That was 37%. The majority of people chose those two options, whereas some people chose the pull-out method. It was just one. Taking PrEP or taking PEP. For PrEP, 14% of people said yes. For PEP, 5 or 6% of people chose that answer. And so that was our pre-survey. Those were our results. And so I hope that you are listening carefully during the presentations by our various speakers, so that we can gain more information and knowledge about how to prevent contraction of the disease, and some other information about healthcare regarding the disease as well. We have some amazing speakers coming on, and so I'm really happy that you have all come and that you are all here listening and ready to learn.
Thank you so much, Reagan, for giving us an overview of what those pre-survey results entailed. And like Reagan said, we hope that we can provide more information to all of you listening, to all of you looking in, on what sex and HIV/AIDS is. Now, without further ado, we will go into the first part, the first presentation of our webinar for today, What is Sex? And that will be spoken on by our beloved Amazing Grace's own Pastor Matthias George.
Okay, thank you very much, Jalisa. And I will be talking on the subject of what is sex over the next 10 minutes or so. We have a slideshow, so I'd like you to put it up on the screen right now, please. Thank you. Okay, so we're going to talk about sex this afternoon. And this presentation is designed to empower young people, and also those who are not so young, to engage in constructive talk about a subject which to a large extent is still considered taboo in many circles, including the church. All right, so we don't talk much about sex in church or otherwise. So this afternoon we're going to talk a little bit about sex. So next slide, please. As we grew up, we were told very little about sex. Most, if not, well, many, if not most of us, we were told very little about sex. Go on. Yes, we were not told very much about sex. We experience our own biological urges, but we were never given explicit permission to ask questions about the subject. And when we did ask questions about the subject, we probably got a lecture as to why some sexual topics were not for us as young people, as children growing up. Things have changed a little bit right now. Next slide, please. And although many of today's parents talk openly about sex, there are still some households where sex is still a forbidden subject. So becoming comfortable with sexuality or with the subject of sex, it requires an examination of one's sexological worldview. And by sexological worldview, we mean the result of the socialization process that comprises your values, your beliefs, your opinions, your attitudes, and other concepts specific to sexuality, which of course would include your sexual behavior, sexual identities, and stuff like those. So everybody has a sexual, sexological worldview. Now, those values, those beliefs, those opinions, those attitudes, they come from many sources, including your family. It comes from your school, your religion, the religion that you belong to, your peers, the media, your own personal sexual relationships, and stuff like those. So the million-dollar question is, what is the source of your sexological worldview? Where did you get your sex education from? Did you get it from the church? Did you get it from school? Did you get it from the internet? Did you get it from the streets? Did you get it from just your own experience? All right. As Christians, Bible-believing Christians, our worldview of sex and sexuality comes from the Word of God. It comes from the Bible. Basically, we base our worldview of sex on what the Bible says. All right. So here are some facts that we need to know. And the first thing we need to know about sex is that sex or sexuality is a gift from God. It's a gift from God. Sexuality means more than sex. It is not what we do, it's what we are. We are sexual beings. We were created sexual beings by God, male and female. He made us male and female. So we are by nature, we are sexual beings, and sexuality is a part of who we are. All right. It's not just something that we do, it is something that we are. Next slide, please. Okay, so if we believe that sex was a gift from God, God had to have a reason for endowing us with that gift. for creating us as sexual beings. And from my studies, I believe God gave sex for three basic reasons. One, for procreation. The second one is for bonding. And the third one is for pleasure. And now there are still some people who believe that sex is only for procreation. And some churches, some religions teach that you should only engage in sexual activity for procreation purposes. But as I outlined here, I believe that God gave sex for procreation. He gave it for bonding. And and when we talk about bonding, the Bible talks about being known and to know somebody. You get to know somebody through the sex act. You actually get into that person for pleasure. And we're talking about the delights of romantic love that is usually culminated in sexual activity. So those are some of the reasons why God endowed us as human beings or his creatures with the gift of sex. Next slide, please. Now, sex is multidimensional. It's not just a physical act. And lots of people believe that sex is just engaging in an act. But sex, there's the sociological dimension to it. There's an emotional dimension. There is a biological dimension. And also there is a spiritual dimension to sex. So when you engage in sex, it's not just a physical act, but all of those factors, all of those dimensions are covered when we speak about engaging in sex or when we speak about sex. Next slide, please. Unfortunately, there are still many people who aren't sure if sex is a perfectly good and wholesome pursuit. There are still some people who believe that sex is wrong, sex is bad, sex is not something that we should enjoy. Some people spend time wondering if they're really fitting in with God's plan when they're having such a good time and enjoying the sexuality. So, and even in church, we find that people don't talk about sex. People, if you talk about sex, if you talk about sexuality, then people look at you as if something is wrong with you. You should not, but we should understand, we should understand that God meant sex to be a transcendently wonderful experience for husbands and wives. All right. God intended that sex was something transcendental. It was not just, it was something out of this world to be enjoyed by those who engage in the act. So sex is not dirty. Sex is not filthy. Sex is not common. Sex is clean. Sex is wholesome. And sex is a gift from God. So we should embrace sex. We should embrace sex and think of it as something positive rather than something negative or something dirty. Now, so something went wrong. If sex is such a good thing from God, what went wrong? Why is it that there's so much negativity attached to sex? Now let's look at from the church's point of view. And it said that early in Christian history, there was a movement that divided things of the body from the things of the spirit. And one was seen as very good, and the other as very debasing and very bad. So anything that had to do with bodily processes was immediately assigned to the evil column. So much so that one church father declared that the Holy Spirit had to leave the room when a husband and wife had intercourse, even though they were doing it within the church's requirement of allowing for procreation. Now, in the early church, there was the understanding, the concept that sex was only for procreation. And so allowance was made for that. But even within that allowance that was given by the church for sexual activity, they still figured, look, when a husband and wife engage in sex, the Holy Spirit left the room. So it's not far-fetched. It's not difficult to understand the aversion that the church has when it comes to talking about sex and sexual activity. So you can't go into church and openly speak about sex because it is thought of as something that is not so good. Thankfully, that is changing. We're addressing the subject, but generally, from a church's perspective, we don't talk that much about sex. All right, next. In there are some secular distortions, and as a Christian, we believe that sex should be enjoyed within the confines of marriage. That is the church's position. We believe that sex should only be enjoyed within the confines of marriage. I always say sex is like medicine, or the same medicine that can make you well can kill you if you don't follow a prescription. So God gave us a prescription, and if we don't follow the prescription, it could do us harm if we don't go according to God's prescription. So we believe that there have been some distortions, secular distortions: premarital sex, extramarital affairs, incest, and child abuse. Those are negative. These have negative connotations, and they have impacted negatively on the whole gift that God gave us. And so now, instead of looking at sex as something positive, we look at it as something negative. They say sex sells. If you want to sell something on television, you get a picture of a nice lady and you put it in there, and you advertise your product. There is the question of prostitution. We have abused that gift that God has given us, and the whole concept of pornography as well. So as a result of all of those distortions, as a result of all what is going on with the subject of sex, that which God has given us as a gift to enjoy, if we do not educate our people, our young people, about sex, about sexuality in a loving, forthright, caring manner, then we are opening the doors for all kinds of problem. I'm going to end the presentation right here. I was told I only had 10 minutes, so I prepared this presentation for just about 10 minutes. But I hope I have covered enough to give you an idea of what we think about sex, what sex is all about. It's not something negative. It's not something dirty. It's something that is clean, wholesome, something to be enjoyed. It's a gift from God, and it's something that we should engage in. We should engage our young people in talking openly in a loving, caring way about the subject and educate them about it. Thank you very much.
And thank you so much, Pastor George, for the lovely presentation. I believe we got a better understanding of what sex is and the church's perspective and stance on sex. You said you addressed a lot of amazing and great points. And right now, I will call on Rose and Rashawn, the co-presidents of Stony Brook University's Our Foundation, AYM, which is our 7-day Adventist club on campus. And they will be asking you questions based off of your presentation. They are the representation of the youth of the SDA church. And I find it very interesting that you said, as a church, we don't really engage in these talks. So we have our youth representatives here to ask you questions, so we could get that talk going.
Okay. I'm ready.
Hello, Pastor George. Just wanted to thank you again for your presentation. So I guess I'll be asking the first question. One of the things you said during your presentation that stood out to me was the reasons for sex, uses for sex, and one of them you said was bonding.
What's for what, sorry?
For bonding.
Oh, okay, right.
And I know that in our generation, and especially me growing up in a Caribbean household, I've heard this phrase before, you don't buy puss in a bag, right? So I know we have this idea that in order to get to know someone, in order to bond, you have to have sex. So how would you counsel younger people to bond with their significant other without having sex?
Okay. The whole concept of not buying a cat in a bag, or not buying before you try, and I say to young people, you're not a pair of shoes. So don't try me before you buy me, that kind of thing. But there are so many wholesome ways we can bond with each other. We can go on dates, and the whole thing is about setting boundaries for yourself as a young person, having values, learning to say no, having a healthy self-esteem. All of those things are very, very important when it comes to approaching the subject of sex. If if you do not have healthy self-esteem, if you do not know how to say no, if you have no values, if you don't know how to set boundaries for yourself, then you open yourself to just doing anything. All right. So you can go on wholesome dates, go out on a date, but if you go on a date, you would have to let your partner know what your values are, know what your boundaries are, know what to expect on that date, and all of that. So it's very important that you don't just tell yourself, well, I need to try before I buy. I need to know what I'm getting into. But there are lots of ways you can get to know somebody by spending quality time with them, going to their homes, seeing how they relate to the parents, how they relate to other people, how they behave in school, and all of those things. You could make very good judgment based on your interactions with that person without getting involved in sex with them.
Thank you.
That is very helpful to understand a little bit how to approach bonding without necessarily having sex. One other question I had was, you mentioned that as Christian we get our values, like our sexuology, I believe the term was.
Sexological worldview, I said.
Yes,
right. Yes.
That term. We
Right.
get it from the Bible.
Right.
When in reality, even as Christian youth, we usually get it from the world. What would you advise the youth on how to be educated about sex, not necessarily from the world, but from the Bible, when the church is not necessarily talking about it?
Right. I think it goes back to what I said earlier. We don't talk enough about sex in church. It's amazing that the Bible has more, speaks more on the subject of sex than almost any other subject. When you go through the Bible, the whole story of the Bible, of the patriarchs and all of those people, there is so much sex involved in all of those stories. Adam and Eve, Jacob, Esau, Joseph, David, all of those guys. The Bible has so much to say about sex. The thing about it is, we do not engage our young people in the subject at the church level. And so we leave it up to them to fend for themselves. I think as leaders in the church, we should make it our responsibilities. And I feel very comfortable talking about sex with young people. When I was pastoring back in the Caribbean, I pastored the church with about 500 members. About 60% of the church were young people. The guys would come at my house on Saturday night. They would cook. They would watch movies. They would play games, and we talk. We spoke a lot about those things. So I think the important thing is finding responsible adults in the church, leaders in the church, who are willing to engage you in those subjects in a wholesome way. You don't trust just anybody with those subjects. You might find yourself trusting one person, and you might be disappointed in that you might be led astray. But find leaders you can trust, and let them guide you, and find values and principles from the Bible that would guide you in your sexual lifestyle, and in formulating values and principles to guide you as far as that is concerned.
I guess we only have time for one more question, but I wanted to ask, saying that sex is like a uncomfortable topic for some people, a taboo topic. If I find myself in a church where I feel that we don't talk about it enough, how can I, as a young person, initiate that conversation in my church, in my environment?
Okay, very well. My comfort with the subject began when I was an AY leader in my church, growing up as an AY leader in the church. I was also a Pathfinder director. So when you involve with young people, they have questions. If your young people come to you with questions and you don't give them the answers, they will find the answers somewhere else. All right. So I figured as an AY leader growing up, as a Pathfinder director, it was my responsibility when those young people came and they had questions, I had to give them the answer. So it became very comfortable for me to speak about the subject with those young people. So as a young person in your church, you have to create the programs. Ask for AY time, and have a subject, have a program on the subject to talk about sex. Let's talk about sex. And Amazing Grace will tell you that, I do this program with them sometimes with the young people during AY time. Let's talk about sex, and we talk, we open the floor, we have questions from everybody. And I think that can be very informative, and it can be a very good way to open the church's understanding as to why and how they can talk about it with young people, and why they should be talking about sex with young people in the church.
Thank you so much, Pastor George, Rashawn, and Rose, for having this little Q&A. And like Pastor said, being a member of Amazing Grace SDA, I do remember those let's talk about sex sit downs. And then like the youth would be in the middle. Like we would have 3 sections and youth would be in the middle, and like we had to be in the forefront, and Pastor George wanted us there to be in the forefront so we can ask our questions and then engage in that. And I do believe that it was a very healthy practice because it helped me to become more aware, and it also helped me to allow myself to talk to other people about it. And being co-president of our foundation AYM on Stony Brook University campus, we definitely can, encourage that type of talk and be those role models for the people on campus. And so thank you so much for asking these questions. And thank you so much, Pastor George, for speaking on what is sex.
Thank you so much, Alyssa, for having me as a part of the program. Thank you.
Of course, no problem. And now we're going to go into the next part of our program, where we will answer the question from the medical perspective: what is HIV/AIDS? Because we have to understand that HIV/AIDS is a sexually transmitted disease. And so now going from the conversation of what is sex, we're now going to transition into the conversation of what is HIV/AIDS. Because like Pastor George was saying, when you are if we're not getting sexual education as a church, if we're not providing that for our youth, then they're going to find it elsewhere. And in finding it elsewhere, they may end up running into really tough situations where they may end up with a STD or a STI. And in cases, there have been cases where people have ended up contracting HIV because of the fact that the church was not safe space, or like we just did not talk about it, or they did not have sexual education on how to go about sex. So now we're going to go into the next part of our program where we will answer the question from a medical perspective: what is HIV/AIDS? Presented by yours truly and our guest speaker, Zachary Frost, which is once again our allergy and immunology community outreach specialist at Northwell Health. All right. And so I would ask if the presentation can be brought up onto the screen. Thank you. All right. Could we go to the first slide, please? Thank you. So now second slide, I'm sorry. Now that you see our lovely faces, before we jump into the presentation, we have some lovely individuals we would like to thank. Firstly, we would like to thank HIV/AIDS clinician Linda Ording-Bauer from Suffolk County Primary Care and Infectious Diseases Clinic. I've had the honor to interview Linda at the clinic, and she was able to provide more insight on what HIV/AIDS is and how they're handling it at that clinic. Quotes from our interview will be included in the presentation. We would also like to thank RN and Community Wellness Project Manager Phyllis Jackson from Common Ground Health. While her insight is not included in the presentation, it will be included in the later parts of our webinar. And last but definitely not least, we would like to thank Stony Brook University's Student Health Services gynecologist, Jean Tully. I also had the pleasure to interview as well, and quotes from our interview will also be included into the presentation. And now we will jump into defining what HIV/AIDS is with the help of Help Stop the Virus's explanatory video. We can't hear anything, by the way. Sorry.
First, know this. HIV is a virus. The letters stand for human immunodeficiency virus. I know what you're thinking. You know what? This is a good place to start because we need to talk about your immune system. Your immune system protects you from disease and helps keep you healthy. It does this with the help of some really important cells called CD4 cells. You may have heard them called T cells. Inside your body are lots of CD4 cells. They are the fighter cells, the defenders against germs. They help keep you from getting sick. But get this, when HIV enters the body, it goes right after these defender cells. It finds a CD4 cell, invades it, and just takes over. If that doesn't sound good, well, it isn't. The CD4 cell is not helping you anymore. It's working for HIV. The infected cell becomes like a factory, making new HIV particles, and these virus particles go on to invade other CD4 cells. That's what HIV does. It multiplies itself inside your body. Now, while this is happening, you may look completely fine. You may feel fine, but the virus is still inside, working away, causing harm to the body. That's the trick HIV plays. Before you even know it, the number of CD4 cells in your body is going down, and the number of virus particles is going up. That's why HIV is an immunodeficiency virus. Your immune system has less fighting power to keep you from getting sick. This can lead to serious infections, to cancer, and of course, to AIDS. The thing is, this doesn't have to happen. You can take care of your health. Now, there is no cure for HIV, but there are many treatments available now to help stop the virus. Remember how I told you HIV works to multiply itself inside the body? Well, HIV treatment stops this from happening. The virus factories get shut down. The CD4 cells go back to protecting. The number of CD4 cells could even go up. That's why it's important to talk to your healthcare provider and start treatment before you feel sick. Waiting just gives HIV more time to harm your body. So don't let HIV build a virus-making factory out of your cells. No way. Take care of yourself and stop the virus.
Great. So I hope you guys got a better understanding of what HIV/AIDS is from that video. But essentially, HIV, which is abbreviated HIV, but it stands for human immunodeficiency virus, is a virus that evades the body and attacks the immune system. So how does, going back to our presentation, which should be pulled up shortly. So essentially things that you have to know, how does the virus go into the immune system? Well, you have the virus, white blood cells, and the DNA, and that is known as the HIV life cycle. Can we please have the presentation pulled up? Thank you so much. So essentially the first step is the virus enters the body and attacks white blood cells, which are specifically known as T cells or CD4 cells. Can you please click? Yes. Then secondly, The virus attaches. You can click as I'm saying secondly, thirdly, yes. The virus attaches and fuses itself with T cells, which was showed in the video. Then it takes control of the DNA code and creates more copies of itself. And then the virus then spreads these copies all over the body, weakening the immune system. And this is known as the HIV life cycle. So now that we have an understanding of what HIV is, we may be still asking, where does AIDS come from? So firstly, AIDS stands for Acquired Immune Deficiency Syndrome. So without treatment of HIV, the immune system grows weaker due to the number of CD4 or T cells decreasing. And when your immune system shows signs of significant failure, it can turn into AIDS. There are two ways that are normally that showcase how HIV turns to AIDS. Number one, HIV turns into AIDS when you have a CD4 or T cell count of less than 200 within the body, or when you acquire cancers or infections that further decrease your immune system. Factors such as age, health, and treatment plan affected the development of AIDS. So you may still be asking, what are the symptoms? So early symptoms, also known as acute retroviral syndrome, can include fever, chills, swollen lymph nodes, sore throat, mouth sores, sore muscle, painful joints, and the list goes on and on. But these are just some of the symptoms that you may experience when you acquire HIV. Now, a frequently asked question is HIV just like COVID-19, where I can detect the symptoms within 2 to 14 days? And the answer is no. In the early stages, you may not have or feel any symptoms, and most people don't. Symptoms usually appear 2 to 4 weeks after infection. So how can you get infected and how you cannot become infected? We definitely are going to stress a lot on this slide, so we have a better understanding of how HIV is transmitted. The most common way that HIV is transmitted is through, number one, sexual transmission of semen or bodily fluid with a positive person. Another way is through drug use, sharing injection drug equipment such as needles from one person to another. A less common way HIV is transmitted is from mother to child during birth. And essentially, if the child is birthed through the birth canal in a natural way, then that is, and the person is HIV positive, then there's a likelihood of the child getting HIV through that process of birth. And so usually I've heard that women go through C-sections in order to not have that happen. But even so, breastfeeding is another way that HIV can be transmitted onto the child. Also getting pricked with contaminated needles. So it rarely happens, like it's a less common way, but getting pricked with a contaminated needle is another way that you can get HIV. Rare cases of transmission have been seen from oral sex, blood transfusions, contact with broken skin / open wounds, which is also known as mucous membranes, and bleeding gums or breast milk. So where HIV enters the body, that is also known, where HIV enters the body is also known as the mucous membranes. So that is the mouth, which is rare. There have been rare cases of people getting HIV through the mouth, anus, rectum, vagina, opening of the penis, and cuts or sores on the body. Now, we're going to stress, you cannot, I repeat, you cannot become infected, or you cannot, HIV cannot be transmitted by breathing in the same air or water, drinking same water as of someone that has HIV, shaking hands with them, hugging, sharing toilets, sharing drinking and eating utensils, sitting with them, cuddling with them, even kissing them, that you cannot become infected through those means, especially when you are practicing closed mouth kissing as seen in the picture below. Now, ever since the discovery of HIV/AIDS in the 1980s, it has been a global issue and not just one that we see in America. So HIV/AIDS on a global scale, as of 2019, in Western and Central Europe and North America, 2.2 million people were infected with HIV. In Asia and the Pacific, 5.8 million people were infected with HIV. In Eastern and Southern Africa, 20.7 million people were infected with HIV. And in Western and Central Africa, 4.9 million people were infected with HIV. So now that we understand that HIV/AIDS is a global issue, we can now bring it back to home. So we can now ask the question, in the US, who's getting infected? So about 1.2 million people in America are living with HIV, and 1 out of 7 people do not know their status or need to be tested because 1 in 7 living with HIV are unaware of their infection. We have to remember anyone can get HIV/AIDS, but those that are at high risk are men who have sex with men, which is also termed as MSM, transgendered persons, African Americans, and Hispanic/Latinos. By age group, HIV infections between the age group of 13 and 24, they have decreased over the years, and the highest rate is 31.5 for the age group of 25 to 34-year-olds, and 35 to 44-year-olds take second place with an infection rate of 16.9. These numbers are taken from these numbers are taken from the CDC as of 2018. So you guys should know these are 2018 numbers that we're pulling from. By race and ethnicity, Blacks and African Americans have the highest rate with 45.4% infection rate. Then Hispanic/Latinos come in second place with 22.4% infection rate. And HIV transmission in 2018, the largest percent of HIV infections were connected back to MSM, which is once again men who have sex with men. And in terms of looking at the numbers, 67% of people that were tested positive contracted HIV through the means of MSM, and 82% among males contracted HIV through MSM. Now going on, looking at a deeper light on who's getting infected, starting with women and girls. 1 in 4 women live with HIV in the US alone. In 2017, 59% of new diagnoses were Black women, 20% were white women, and 16% were Hispanic/Latino women. Another thing that I have to disclose, for these rates that I'm reading, the majority of the women that were contracted HIV were heterosexual women of color. And that's something that I have to stress again, once again, they are heterosexual women of color. According to HIV Practice Fighting to End HIV, they state, women may be unaware of their HIV risk, unaware of their male partner's activities, or have competing family priorities like, going to work, taking care of children, and other stuff within their lives. And so because of this, they delay seeking care. There also have been many cases where colored heterosexual women contract HIV due to being in an abusive relationship. So instead of being assertive and having a say in what goes on in the sexual encounters they have with their partners, they end up giving into what their partners want and now are at a risk for HIV transmission. A disturbing fact that is seen on the slide is that 55% infection rate is due to intimate partner violence. Additionally, women who engage in sex work place themselves at a risk for transmission when having multiple sex partners or exchanging sex for drugs and are not able to be assertive with their sex partners. Asking them, have you tested negative for HIV? Or saying no glove, no love, meaning no condom, no sex, would be helpful in their work. But even if they may ask, people can lie and force themselves on sex workers, which there have been many cases of that happening. And so still sex workers are at a risk for transmission in this light. But looking at these numbers, seeing that 55% infection rate is due to intimate partner violence, like basically abusive relationships, and also women not being assertive to ask questions and to engage in the conversation with their partners. Organizations such as the Sister Project and Balm In Gilead have been working to provide a safe space for abused women and help them become assertive, become able to say no to forced sexual encounters and engage in conversation with their partners before proceeding with sexual activities. But as a church, we do have to provide a safe space. We have to work towards providing that safe space for women as well, to be assertive and to really be in the process of saying yes, no, and knowing what is going on in their sexual activities. For Black men accounted for 39% of HIV positive cases in 2018, which is the highest rate in comparison to men of other racial groups. So within the US, The person that is most affected, the person that is high risk of getting HIV is a Black male. I have a graph put up here, and it breaks it down for the infection rates of 2018. 79% of 79% of people that tested positive for HIV of men, they contracted HIV through male-to-male sexual contact, which is once again known as MSM. 15% contracted HIV through heterosexual contact. 4% contracted HIV through injection drug use, and 2% contracted it from both male-to-male sexual contact and injection drug use. Going lower on, reading the bottom of the graph, for women, in 2018, the woman that tested positive for HIV in the US, 92% infection rate. 92% of women contracted HIV through heterosexual contact. So once again, going right back to the intimate partner violence, and also not knowing, really not being able to ask their partners questions, or questions to the other sex, to the men. Hey, what are you doing? Who else are you having sexual contact with? Because once again, high rates of infection come from MSM. And then some men do not disclose their status. Some men may be on the down low, and therefore then have sex with women, and then they can then transmit HIV through that way. 8% of HIV, 8% of HIV transmission in 2018 for women were also from injection drug use, and 1% came from other means. In both categories, those who engaged in male-to-male sexual contact amongst men and those who engaged in heterosexual sex amongst women and men have had the highest rates of HIV. From young to old, the youth averaged at 21% in 2018. 51% of the rates were Black youth. And people 50 and older averaged at 17%, and most were men. And something that I have to disclose with these numbers, the 51% of the rate that were Black youth, they engaged in MSM. Most of that number were Black men that engaged, Black male youth that engaged in MSM. And for men that are 50 and over, they also engaged in MSM. Most of the rates came from that as well. And so that wonderfully leads into our next slide of how when HIV was discovered in the 1980s, it was known as the gay man's disease. So as we can see, a pattern in transmission for men is that it's sexually transmitted through MSM. Because of this, HIV in the US was originally seen as the gay man's disease. I'm going to give you some history here. According to Adventist, which is a health newsletter, strange cases of illness were being reported among gay men in New York and California in 1981. The cause of these outbreaks were unknown, but it was concluded that it stemmed from an infectious disease. At first, the disease was called all sorts of names relating to the word gay. Then in 1982, scientists realized the disease spread amongst other populations, such as heterosexual, women, and heroin users. By September 1982, the disease was named AIDS. The less severe case is known as HIV. So once again, I have to remind all of us that anyone, I repeat, anyone can get HIV/AIDS. So we must break the stigma. As much as we do see the rates happening between men and other men, we still do have to break the stigma and not just see HIV as the gay man's disease, because it is not. It is everyone's disease. And a quote from Linda Ording Bauer, when I interviewed her on this, she says, non-stigmatizing MSM would go a long way. Now, I'm not saying that MSM is great or right, but in my mind, if you believe that God is our judge, and if it's really bad, then God will just judge me accordingly. We are all God's children. We're worthy of God's favor and grace. And so our main worry should be in supporting each other in whatever, whether it's cancer, HIV, mental health, or talking about sex and safe sex practices. Continuing on from quotes from Linda and Jean, these are the commonly heard medical misconceptions and stigmas of HIV/AIDS. Linda says, I still have some patients that feel or think that HIV was developed to kill gay people and Black people. And in the beginning of the HIV outbreak, Linda remembers hearing people say, I can tell if someone has HIV/AIDS, just like gaydar, they have AIDS-dar, which to me makes no sense. And she also says some misconceptions or stigma is she hears from her patients, they say, I do not want to look like an HIV/AIDS patient. And we're going to go more in depth on what that looks like a little later in our webinar. Also, she says most older women think that once they've gone through the changes, they think, oh, I don't need a condom, I'm not going to have a baby anymore. So for women that contract HIV once they're over the stage of menopause, they think, oh, okay, hey, I do not have to have a condom, or I don't have to practice safe sex because I'm not going to get pregnant anyway. But the reality is, while you may not get pregnant, you still are at risk of contracting HIV and other STDs and STIs. So that's something else that we have to break. We have to break these stigmas. From Jean, she says, some people think that they will have a death sentence and no one will ever love them again. She also, and I quote, she says, I can't use the same kitchen or eat from the same eating utensils that an HIV person may use. And that is a misconception that people have. And it's also a stigma. It's been stigmatized. And so people that may be around HIV positive individuals, they may not want to sit next to them, or they may not want to eat alongside them because they think that they're going to contract it just by being around them. But that is once again, that is a misconception that we have to break, and we have to not let other people, we don't have to spread that information. She also says, when you look at the commercials that advertise for Biktarvy and other medicines that go for HIV positive individuals, she says, see how they have the patient or actors socializing with others, eating with them, etc. I believe it's there to break down the stigma and normalize interaction with positive individuals. Right? And I do agree with her on that statement. But not only have there been commonly heard misconceptions and stigmas within the medical field, but there have been some misconceptions within the church that have been pushed towards the public. And so Linda, she's while also being a clinician, she's also a Christian woman, and she gave her account on these things. So she said, some people don't believe in treatment, and they thought that being born again cleansed them spiritually and physically. And I quote, she says, it's more than just asking, it's about finding the answer. I've had a number of Black women from the church who became positive because they were involved in the church, and they met men in the church who had histories of former drug use, who were on the down low, practicing MSM, overall had complicated former lives, turned themselves around, but never tested. And some of these men thought, because of the fact that they've been born again, that they were both spiritually and physically cleansed. But that's something, once again, is a misconception. That is not true. God comes onto, like, God is here. He's a part of you when you get baptized, but your physical ailments, you still have to, faith without works is dead. So you have to still work towards those things. You still have a human body. And so that's something that we have to address, and we have to understand that. Because I will continue reading the quote. She says, because these men never tested and they were in the church, these women had unprotected sex with them, and then they became positive. And there have been multiple cases of women, Black heterosexual women in the church, getting HIV because of this. Another misconception and stigma she quoted for me is that people think that HIV is associated with gay men, so you don't support it and you don't see it, and we see it as an evil. This was an experience that she had with her brother-in-law. And I quote, she says, my brother-in-law became a born-again Christian, and I remember him telling my husband and I, my pastor says that people with HIV deserve it because they're out there doing bad things. She responded, oh, really? So for most women, their only evil is having sex with their husbands. What about the children? Their evil is being born to parents who are HIV positive, and they were transmittable. What about those who were sexually coerced or raped? I think you go better correct your pastor. And I'm very happy that she told her brother-in-law that, because yes, he does need to go correct his pastor. And now we're going to go a little bit on HIV/AIDS and COVID-19 and how we're handling it. And I will now pass the mic over to Zachary Frost. We will talk more on this as well as some other things from Northwell Health.
Hi, everyone. How are you? My name is Zach Frost, and I am a part of the team at Northwell Health that essentially we work with patients, adolescent patients, pediatric patients, and young adults who are either living with HIV or looking for ways to prevent HIV. So we work a lot with the MSM community, men who have sex with men, as well as pediatric patients who may have been born to a mother who has HIV. And those are typically our patients. So first, we're going to talk a little bit about HIV, AIDS, and COVID-19. So one of the questions we get a lot is, are HIV positive individuals at a higher risk of getting COVID-19? And the answer to this can be a little bit complicated, but essentially, you are at the same risk as everybody else, given that you're under the age of 50, right? So once you hit that age of being 50 years old and over, we know that COVID is affecting the geriatric population a lot more than it is the younger individuals. Another key concept to this is that you have to be at a healthy point, right? So being undetectable, and I'll get more into that later, but remaining undetectable and keeping up with your HIV medication regimen is extremely important. So you want to make sure that your immune system is healthy. And there's a bunch of different factors that go into that, but keeping that immune system healthy, staying on your regimen, there's no difference between you and somebody else. And now, of course, if you have diabetes or asthma, other underlying medical conditions, then that is a concern, and you should be a bit more safe. Of course, always wear your mask, wash your hands all the time, limit your exposure and whatnot. Another question we get a lot is the COVID-19 vaccine safe to get for those that have HIV and AIDS? Yes, it is safe. So there's the data on this is a bit limited, but the CDC and the FDA, the people who have gone through the trials for the various vaccines, people that have HIV, that are living with HIV, were in those trials, and they were fine. Once again, speak to your provider about it, but the vaccine is safe for those living with HIV and AIDS. I think there was one more. Oh yeah, okay. So what can someone who's living with HIV, what can they do to protect themselves from COVID-19? Like I said, this really comes down to staying healthy, staying on your medication regimen. And a big key part of this is also going to be mental health, right? Mental health is a big thing for anybody. You don't have to be living with HIV. And something that goes into mental health is eating well, right? Nutrition. You want to reduce stress. Stress takes a huge toll on your body, right? People really don't get that, but stress is a huge factor when it comes to maintaining a healthy immune system, as well as getting 8 hours plus of sleep. I know I like 10 hours usually, but also maintaining a good social network and keeping in touch with family and friends who are there and supportive. Go to church, go for a walk, do something that gets your mind off of everything else. I mean, of course, there's a little bit of natural anxiety with COVID-19 and everything, but those are some things that you can do to protect yourself from COVID-19 while living with HIV. And that goes for everybody, though. I mean, go on walks, eat right, sleep well. Yeah. I don't know if this was a slide. Oh, they got reversed. One more. And there was one more slide after that. There we go. Okay. So now we're going to talk a bit about preventative options. And this is great because we've made a lot of the medical community. We have made huge advances in this sector as well as for the treatment options, but I'll get into that right after this. So I'm going to hit two big preventative options, which are going to be PEP, which is post-exposure prophylaxis, as well as PrEP, which is pre-exposure prophylaxis, and they come in at different times, as well as using condoms, limiting your sexual partners, and of course, abstinence. Abstinence is the only sure way to protect yourself from contracting HIV in a sexual manner. Of course, blood transfusions, which doesn't really happen too much in the United States, is another way, as well as being born to an HIV positive mother. But once again, we can also prevent that, which is great. So I'm going to talk a little bit about post-exposure prophylaxis. Post-exposure prophylaxis is something that has actually been around for quite a long time. It's a regimen of medication that can be taken for 28 days. It's 2 pills, right? And it can be taken for 28 days. And it needs to be taken within 72 hours of exposure to HIV. So I noticed something before in the slides. I think it was 59% of new cases, I believe was one of the data points, that people were contracted HIV through domestic violence. This is something that we've seen. I've seen this at work. 55% actually. Thank you. And we've seen things like this. And so those people can actually go on something called post-exposure prophylaxis as long as they come into us within 72 hours. You don't have to know if your sexual partner is positive. They may not tell you that. But if you feel like that you want to be extra safe and you want to protect yourself, you can go to your ER, you can go to an urgent care center. I'll see if someone can put my email address up there soon. You can email me, we'll get you into care as soon as possible, or call a hotline. But essentially 72 hours, it eradicates or limits the chance of you contracting HIV, but you have to take it within 72 hours. Another great thing is PrEP, and that's pre-exposure prophylaxis. We are making huge medical advances here. HIV is actually seeing a lot of big moves. We're doing a lot of great things. PrEP is pre-exposure prophylaxis, like I said, and you can take a pill once a day, and this limits your chance. It's over 90% effective, actually over 95% effective at limiting your chance of contracting HIV. So this may not be for everybody, but this is for those individuals who may have multiple sexual partners, may not be using protection. And we don't have to agree with these things. You don't have to agree with it, but there are people out there who are not using protection. They have multiple sex partners, and this is for them. PrEP is a great tool. People should utilize it. You can email me. I'll tell you more about it. It's great. There's so many great things out there. And now I'm going to branch into some of the treatment options that are around. Gone are the days where people are taking cocktails of medication. People are not taking 7 pills anymore. That's a big common misconception, and I don't like when people say that, because most of the patients that are in my clinic, I believe, are on a 1-pill regimen, maybe 2. But these are extremely useful, and they can get you to a point where you are undetectable. And this is key, because being undetectable means that you have such a low viral load that HIV cannot be transmitted. So it can't be transmitted through semen, vaginal tissue. It can't be transmitted as long as that person is undetectable. And that is why it is so important to take your medication on as your provider prescribes it, right? Another great thing with treatment options, and this, I believe it was in January of 2021, the FDA approved the first long-acting injection drug treatment. So instead of having to take a pill every day, right, which this can be hard, and we see this with like a lot of parents, right, like a lot of mothers who are juggling so many different things, right? They might have a kid. They have a kid, they may be going to work, maybe going to school. There's a lot of different things going on in their mind. It's kind of hard to remember to take a pill every day. So this is something that's probably that would be great for them, is you would go there and you would get this injection, and it's essentially your HIV medication, but an injection, and it can last. I want to say it's 30 days, but down the road, I'm foreseeing that this is just going to the time frame is going to get a little bit longer, right? So you might only have to go to the doctor's office once every 2 months, once a month. And that's great. That's great for people with busy schedules who have a lot on their plate. Like I said, if you have any more questions, you can email me. My email is below. And I just want to say really quickly as I'm finishing up, I think this is great that that we're doing this. And JJ, thank you so much for putting this together. I think it's really important. And for everybody watching, just know that by you just being here and you listening, you're educating yourself, and you never know when this information is going to come in handy down the road. You may save somebody one day. You may be able to say, hey, maybe you should go try out PEP or PrEP. Maybe this is for you. So kudos to you, and thank you so much for being here. And like I said, JJ, thank you so much for putting this together. This is a great forum, so I appreciate it.
Thank you so much, Zach. I appreciate you so much. Thank you for coming on and speaking, especially being a representative from Northwell Health. Thank you so much for coming on and talking and giving information that we all know that we all would benefit from. Right now, we're going to take 1 to 2 questions from our panelists. Does anybody from our panelists have any questions to ask Zach? I will direct those questions over to Zach, him being the allergy and immunology community outreach specialist. So does anybody have any questions? If we do not have any questions right now, we will go straight into the next part of our webinar. We do have a Q&A session later on where everybody will come on. We will be getting questions from the chat. So if anybody has any questions, if anybody does not have any questions right now, we will just wait to our Q&A session later. Okay, I see that there are no questions from our panelists. Thank you once again, Zach. And we will now go straight into the next part of our webinar, where I have the pleasure and honor, privilege to introduce Corey Chisholm. He is a spokesperson for New York State Health Department's HIV Stops With Me, which is also our sponsor for this lovely event. Thank you so much for providing the stream service and also providing all the help that you have provided, Corey. We thank you so much. And so now I will turn the mic over to Corey, and he will talk more on what the campaign is doing, and we'll give more information. And without further ado, Corey.
Oops. There we go. Good afternoon, everyone. Good afternoon to listen. Thank you for having us and for giving us this opportunity just to educate, bring aware, and discuss HIV amounts in our church community. And it's just an honor to be able to have that platform and to kind of break those grounds within our Adventist community. So it's just a pleasure being here.
Pleasure to have you, and the floor is all yours.
Sure. I've told my story so many times, so I'm like, well, my name, as you know, is Corey Chisholm. I like to say Corey Anthony Chisholm, but I'll take Corey Chisholm for today. I am one of the many spokespersons with the New York State Department of Health campaign, HIV Stops With Me. And I've been living with HIV now for over 12, I'd say 13 years. I found out that I was HIV positive at the age of 16. And currently, I was at the time living in Guyana. I now live here in New York City. And most people have wondered, I say, he's young. How did he become HIV positive? And, you know, as a young person, I want to say I was fortunate to have the opportunity to be educated on HIV and being a peer educator myself. That's where I started working with beautiful organizations in Guyana called Youth Challenge Guyana and Volunteer Youth Corps. And, you know, in 2005, HIV rapid testing had just launched out, and I wanted to go and get tested because I wanted to feel, you know, the fear the church has to talk about sex is the fear that we had when it comes to HIV testing, because you don't want to know the results, but you want to get tested. And so as an educator, of testing, I went and I got tested, and the results came positive. It shocked the people that were doing it. We redid the test, and the results was exactly the same. And being the young person that I am, I started flashing back, like, I'm not sexually active. Where or how did I? And I was so suppressing how I felt and what happened to me. The year before that, I was raped by 3 men, and that led to me, after, by suppressing that and not talking about it, not realizing that was the cause of me living with HIV today. And that's how I contracted HIV. And ever since then, I have tried my best not to talk about it. I was very secretive, and I realized that that wasn't the way to go, and I wanted to do something that was different. And so I started doing more education work, and I moved here, lived here now. But back then it was so difficult, and it was over and over becoming very challenging even to date. And I've listened past to talk about dating, and dating, it was really difficult because back then, so advanced treatment wasn't here. And it was hard. But I made it out, and I made a promise to myself back then that I still keep today. And that's why I'm a part of this great campaign that is working on self-esteem, that is working to promote testing and HIV prevention within our communities. With the campaign, is that I wanted to ensure that I don't, continue a trend of transmitting HIV to others. And so I said, you know what, I'm going to be the face. I'm going to go out there, and I'm going to, start living it up. And in my dating, I know I will say, hey, how you doing? And I'll, from bad on, if I know I'm getting feelings, I'll be like, I'm HIV positive. And some people, at first, I'm just like, okay. And then it disappeared, and it became a norm, water off a duck's back, I know I'm gorgeous. So, I ain't got no time with that. And that's how I treated myself, and that's how I carry myself throughout and on. And so far it has been a struggle, even to when Zach talked about being undetectable. As someone who is on treatment, when I started out, I wasn't on treatment, and I didn't want to get it because I know once you start taking those pills, you're stuck on the pills. And I was like, you know what, I'm gonna do it. If I want to stay longer, I'll be honest with you. When I found out HIV positive, I didn't plan on living past 30. Today I'm 33. Next month I'll be 34. I didn't plan on, so I started doing everything I wanted to do, going out. And I was brought up as an Adventist person. I born and bred. My entire family were Adventist to the bone. I don't know any other doctrine in my mind. And I really started going out and being a bit more, but trying my best to keep in the values of the church. And this is why I'm so happy to support this conversation and work with Jalissa and work with the team. I see one of my TLTs, actually, Rayshawn Davis. I taught him as a Pathfinder. I was happy to see him still, involved, and he's all growing up now. He's not shy. He's asking questions. Sorry about that, but congratulations. And, I'm so happy to support the campaign and bring the campaign. And I'm looking forward to have more conversations with other young people in other churches within our, various conferences, and just have an open conversation, not only about HIV, but the other things around sex and sexuality. Those taboo things, we think they aren't taboo. We're living in a box by ourselves if we think that those things are not taboo. They are. You get uneasy. If I'm a 15, 16, 17-year-old mentions sex to their parents, there is an air in the air. Everybody is like, she said, or did she not say it? You have that look on your face. So we need to get where parents are comfortable to sit down with their 13, 14-year-olds and talk to them about sex, because they're going to air it on the internet now. It's even better now than when I was young. I'm very animated. So, I've been an adventurer, Pathfinder, in club ministry. So I'm animated, right? I have a lot of energy today. But that's what I really want to reflect on. I thank you guys for having this conversation, for giving the information. The statistics is alarming in various communities, and as you were reading out, Jalissa, those statistics, I also thought of what people are getting from them, and you mentioned it very well. Because there was a lot of gender and sexual minority statistics, and we also want to realize that those statistics, may be global, maybe specific to New York City, and there's a lot of different social drivers of HIV and HIV prevention work, and so everyone is affected. There is nothing special about someone who is of trans experience, someone who is a man who has sex with men, someone who identifies as a cisgender or transgender, or whatever the gender identity or sexual orientation is. HIV does not go after that. It's just human. There's a host. I always say, in order for HIV to be transmitted, there must be a point of entry and a point of exit. They do not look at skin color. They don't look at anything else. The virus just know that I have a host. I'm going to enjoy and feast, as you see in the video, and manufacture more and more. So as someone who's also on treatment, it's sometimes rough and hard, and support is needed for persons who are living with HIV in our community. There are still young people who are, getting infected in many different ways, not just sex and rape. And also, let's not play the blame game, where he was just a wild boy out there doing his thing. Everyone goes through things, and everybody go through. We talk about mental health in various ways, and it affects people, whether it's in or out of the church. It's very, very important, to look into that. So, in closing, in sharing my story, I am positively living with HIV, and I am proud to say I'm someone who is undetectable, who is on treatment, and here to talk to anyone and open. You can go on our page, hivstopswithme.org, click on my story. You can hear more about my story and the other spokespersons, and you can ask questions. And we're there to support. You can invite me or any one of our spokesperson community to come to your church, to come to your community health center, your youth group, whatever it is. Doesn't matter. Doesn't have to be faith-based, because I know we have other people who are watching, to really spread the word and really make let's end AIDS 2020, end the epidemic 2020 is what our focus is, especially here in New York State. And, that's why we're doing this. And that's why we're kind of bringing awareness to that. Also, last plug, today is National HIV Youth Awareness Day. I could not forget that. And I want to, just big that up right there. So this happened at the right day, at the right time. Jalissa, thank you for just bringing that awareness on this particular day. There's so many actions that are out there, so many policies needed. We need sex and HIV and sex education in schools, and, get it more going. And so I am advocating for that. Go and sign the petition and check that out. Thank you so much for having me.
Thank you so much, Corey, for coming on and speaking. Honestly, whenever I hear you speak, it's like you speak life, because not only are you so enthusiastic, but you're informative on what you're talking about, from your experiences all to the information that you provide. Wonderful, 10 out of 10. And thank you so much for saying today is National Awareness Day for the youth of HIV, for youth for HIV/AIDS. Thank you so much, because I forgot to say that, and I'm happy that you said it.
No, that's me. I'm plugged into everything. No, I've worked globally with HIV and young people, not only the Caribbean region, but I helped start the global network for youth living with HIV that's connected with the global network of persons living with HIV. We call this Y+. So I was a part of that, creation of that's there globally. And so I'm always plugged in to these little things, because as a young person, I know what it felt like being a teen HIV positive and living in the world. And so, that's the whole reason why we do this, and why I'm excited about, getting the word out there.
Exactly. And now I'm going to add Desmond Jenkins Sierra. He is our non-denominational Christian representative, and he will be asking you questions.
No problem.
And I'll pass over the mic to Desmond.
Hello. First, I just want to say thank you, Jalicia, for having me on here, and thank you, Corey, for sharing your testimony, because not only has it touched my life, but it has touched everyone else's life that is currently watching this live stream. So I just got two quick questions for you, and my first question is, how has your relationship with God been ever since finding out your HIV positive status up until now?
I think I've always had a strong connection for even since from like 13-year-old with God. I love music, and that's my main connection there. Give me some gospel music and I am good. And the word is good, don't get me wrong, Pastor. I want to hear your word. I want to hear your own wheat bread, your Caribbean people say. I want to hear that word. But I also always had that connection. But as I got older, I didn't plan on living in 30. So when I saw 30, I was like, God, what the heck you doing, man? I'm here. It just kept opening doors for me and making a way. And I started to make more room so that he can fill that room. And that has been my relationship with God. My relationship with God, I always say, and it's an Adventist saying too, it's a personal, salvation is personal. And so that is how I have looked at it. And that's why I've always been able to work. Let me tell you, when I was a young peer educator at 12 p.m. in the nights, I used to be on the street educating commercial or sex workers. And I was 17, 18 at that time. And it doesn't matter because I'm Adventist and what they're doing. I wanted to make sure that I'm educating everyone, not because they're not Christian or who they are. And that has been my connection. Being like Jesus means to do the things that people would consider not, that I'm not going to do that. That's their choice. Yes, because God gives us a choice. But I am choosing now to still have a relationship with anyone, regardless of who they are and what they do. And that has been my relationship with God. Doing this helps me, like helping out people is my connection, and it's every time it's increased more and more and more. I have more of a connection with God as I get older, as I think about where I've come from. I've come from a place where after being sexually assaulted, I hated Black men for a good period of time. Like, men was not, like, I couldn't understand why, this would happen to me. And I had to go through a process of talking to God and having that connection. And I've come a far way. So the smile is that the smile I always have, and the enthusiasm that I have for the work now, is because I know that I serve a mighty God who reigns above. So that's it.
Yes, I'm so blessed to hear that. And like I said, like, your testimony really has impacted not only my life, but everyone else's life that is currently watching this live stream. And my last question would be, how would you encourage others that are living with HIV to be open about their diagnosis and not just hide it, but embrace it? Because we all have our struggles, and our struggles are what make our testimonies.
Definitely. One of the things that the campaign this year, the theme is role model. And this is our high role model. And I've always encouraged, the simple little things, having conversation. There are people who are my friends who come up and just ask questions, and I'm able to be just authentic and have honest conversations with people around you. Don't assume that a person, no, just ask the question, I think is one. As someone who's living with HIV as well, it can be tough. Surround yourself with people that are going to advance your mental, physical, and just spiritual well-being. As someone who's living with HIV, it is rough. There are many things you have to be aware of, and your immune system is being broken down. So there are a lot of things you can catch and worry about. Know the facts. Talk to your doctor on a constant basis. Have that type of relationship. Some people are very connected with their families, but I don't have family around in New York since I moved here by myself. But I have great church family, as well as great friends in the community that I connect with, that I talk with, that I can share and just bond. That's basically, I would say, surround yourself with people that is able to help you. And once they're able to help you, you're able to help everyone in your community. So that is like the main thing for me.
Yes, thank you again, Corey, and thank you again, Jalicia, for just having everyone that's on the panelist on this live stream. Thank you again.
Thank you so much. Your questions were needed, and I'm so happy that Corey answered them wonderfully as always. And so, if for those that are watching, if you guys have any more questions directed to Corey, we once again will have a Q&A session at the end of our webinar, and we're almost there because we have one more part, and I have now the pleasure to introduce. We're going to talk more on the church history with HIV/AIDS with a faith-based organization representative, Carrie Goodman from the Balm in Gilead Incorporated. Hi, Carrie.
Hey, Jalicia, thank you so much. Can you hear me okay?
Yes.
Okay, perfect. I always get nervous on these various virtual moments. So thank you again for having me today. And again, thank you for all of the work that you have done to make today happen. So, kudos to you for that.
Thank you so much.
All
And
right.
now, yes, I will now hand you the floor, and you can talk on the church's history. And yeah.
Great. Thank you. So before we get started, we want to show a brief video, and I hope that is queued up. So if you have the video, you can go ahead and begin.
When an epidemic of biblical proportions devastated communities across the country, private religious organizations like Balm in Gilead stepped in to help. But more conservative Black churches met the crisis with a mixture of disapproving silence or overt criticism.
You cannot say, I was born this way. I don't care what scientists say. If you say you were born this way, then you're saying, God, you're a liar.
Many Black Christians are as conservative as Mormons around questions of sexuality, around questions of abortion, around issues of women in the pulpit. We can go down the line.
AIDS is everyone's issue. It doesn't belong to one sexuality or to one race or to one group of people. It's everybody's issue.
During the dying years, the early years, as I call HIV, I was losing tons of people. Found myself trying to bridge the chasm between how to be a person of faith and also do work in the earth.
Will of God is complicated. Because sometimes God asks seemingly the most of you when you seem to have the least to contribute.
All right. I want to thank again Jalicia for the opportunity to be here today, and also thank the pastor of Amazing Grace SDA for just allowing this space for us to have this conversation. And so what we saw on the video, it was a short snippet of what was recently premiered nationally of the Black church. This is my story, this is my song, that was featured on PBS. And Henry Louis Gates produced this amazing documentary, and he left space to show the importance of raising awareness of public health within the faith community. And so I think it is a perfect segue for where we are now. The last piece in that snippet that we saw, it basically shared this is everyone's disease. This is everyone's disease. And we have to be mindful of that in the work that we're doing, in the conversations we're having around various health topics, whether it be HIV, AIDS, whether it be mental health. We have to keep in mind that this is everyone's disease. And so today we're here talking about dismantling the status quo. And so me as a researcher, I tend to pick words apart just a little bit and try to make sense of it. So what is the status quo? What is the status quo? And so today it is defined, or it's defined in Merriam-Webster dictionary as status quo is defined as the way things are now, our current situation. And I'm going to let that resonate with you for a moment, because when we look at HIV/AIDS and we look at other health disparities, we have to understand how things are today. And so this year, we're celebrating 40 years in the fight of HIV/AIDS. 40 years. Which means that in 1981, that was the first incident in the United States of HIV/AIDS. And 40 years later, we're still having conversations around HIV and what we can do as a people to do something about it. And so, really quick, I don't want to be before you long. I know we've been on and we've heard a lot of information. We've heard a lot of data, and I don't want to bog you down with that today. But the Balm In Gilead and our founder, Dr. Pernessa Seal, was founded on the premise of a little idea. And so her little idea back in 1989, it was to go knock on doors of faith leaders and saying, we are having this Harlem Week of Prayer for the healing of AIDS. And the we in 1989 was her and the Lord. It was just her with her little idea. Let me say that again. It was just her with her little idea. And so we often say this in Christianity: little becomes much when you place it in the master's hand. And so her little idea took shape because she said, there is a need, there is something that we have to do in Harlem, New York at that time. And we need to come to the bedsides of those who were in 1989 dying of this dreadful disease, which was known as HIV. And so fast forward 32 years later, we've moved from the Harlem Week of Prayer to the Black Church Week of Prayer, and now we call it the National Week of Prayer for the Healing of AIDS, because we understand that there is a need far greater than just one city, than just one jurisdiction, than just one church, really. And so the little idea has taken shape. And so I commend Jalecia, and she doesn't even understand the power of her little idea of us being here today. She really doesn't understand that. And so as Corey mentioned previously, that today is National Youth HIV/AIDS Awareness Day, we have to be mindful of those moments that today, this little idea that Jalecia had, that she had to get approved by the pastor to say, we have to do something, because in 2021, there is still a devastation of HIV/AIDS amongst our community. And so as I close out, I know I'm going to be talking with the pastor momentarily. I'm answering a few questions, but something that struck with me in understanding the status quo. That is, again, it's defined as the way things are now. Before I give the scripture, I want to say this. In order for us to get where we want to go, we have to understand where we have been. But we also have to be mindful of what is happening in our own backyards, on our own front porches. What's happening with our neighbors next to us? What's happening in our families? What our friends are dealing with? We have to constantly be mindful because if we're defining status quo as the way things are now, that means that what happened yesterday is no more. And so in First Corinthians, the 7th chapter, and I'll read two different verses. It's the 17th verse and the 24th verse. And I'm reading the New Revised Standard Version. It says, however that may be, let each of you lead the life that the Lord has assigned, to which God called you. And then the 24th verse says this, in whatever condition you are called, brothers and sisters, there remains God. And so I'll leave you with this. The little ideas that we have, we cannot let them go to waste. We have to take those little ideas and run with them. As the word of God declares in Habakkuk, we have to write the vision and make them plain on tablets, that they who read them can run with them. And so thank you so much for this time. I guess I'm now sharing with Pastor Neville. There you go, Jalicia, somebody.
Yes, Pastor Neville Lindor, the pastor of Amazing Grace, SDA Church, my church, will now come and speak and ask questions to you, Carrie. So I will now give the floor to Neville, Miss Pastor Neville Lindor.
Carrie, I just want to thank you so much for being a part of this. And I just want to thank Jalissi again, because one of the things that I recognize is that our church lacks education. We're very silent when it comes to sex. And let's not even get started on the HIV topic. But one of the things that I thank you for the clip also that you shared with us. One of the things that I want to know is, as a pastor, how do I begin, besides this forum, to really educate our congregation to make it more of an open dialogue? Because we know that in the church, nobody wants to talk about sex. Even when you heard Pastor George speaking about, how people's worldview are different. And we get to this point where it's like the time has changed so much. How do we begin that conversation?
So I'm so glad you asked that question. And before I answer that, I want to give kudos to Pastor George, because one thing that he stated that was so key, and it kind of sort of flows with it. We have to engage young people so that they don't have to fend for themselves. I think that's so key because one, we understand the things that we have been through in our lives. We understand that we all have not been perfect. And so having those real life conversations tends to open doors, tends to create space to have further dialogue. But you, as the pastor, or I'll say the senior pastor of the church, you have a unique space and opportunity. Why? Because you have the ears and the hearts of the people. You may have it just one day a week, but if you have the passion to give just one nugget a week, to say one thing a week, or even utilizing your space beyond the pulpit to say, hey, we're going to do X, Y, and Z. Now, here's the thing. You have to preference it, and it's unfortunate you have to do it this way, but you may have to say, this may not be a comfortable conversation. But in order to strengthen the people, you have to be willing to take some lashing, because there will be people that will say, I can't believe the pastor said that. There will be people that will say, I might have to switch my membership because the pastor has gone crazy now. But you have to be willing to just take a step out. As Jesus told Peter, take a step out on the water. And in order for you to shake the people up, in order for them to do something different, you have to be willing to tweak and change the way that you handle the conversations.
Okay. So I'm not sure how many questions I'm getting to ask, but
hey,
I do want to find out. So the video was something that really got me, because right in the very beginning, you hear one of our famous preachers preaching, and we have a certain stigma within the church, or a way of seeing people who have HIV, and we just paint one broad picture, right? And unlike the heart of the lady that started your foundation, where she realizes that this is everybody's problem, right? How do I find resources for myself as a pastor to not only educate myself, but to also teach my congregation, so that when I'm preaching, I can actually preach fact from things that are there versus things that are just how we feel because of our worldview. And sometimes, even when we look at a text, we try to get our own, as my teacher used to say in the seminary, eisegesis, because it's not in the text. You know what I mean? We put our own spin on it instead of exegeting and seeing what God has.
So that's so key. So one thing that I'm very big on this, is partnerships, building collaborations. So one thing that, and even today, finding those trusted sources in your community, reaching out to your local health department. I say this every time when I talk to people. We want the pastor to utilize the power of the pulpit in order to get messaging out. But here's the thing: if the pastor didn't go to medical school and he's not a medical doctor, we cannot expect the pastor to have all of the facts and information. So we have to be willing.
Can you say that again, Carrie?
Let me say it like this. I say this often. My pastor can fix cars, but my pastor is not a mechanic. And if you want it fixed, and you don't have to worry about it breaking down again, you got to make sure you go to somebody that knows exactly what they're doing. So here's what I tell people: give the pastor a couple points, 3 points, that he can share on a Sunday morning, that he can share during a Bible study, or Saturday during Sabbath service. Share those 3 points, and it helps the pastor, one, not make a fool of themselves, because sometimes pastors get up there based off of what they heard on the news and say whatever, and it may not come out the way that it should come out. But if they have persons that are heads of the health ministry, or like a Jalecia, she gave a very thorough presentation. Take 1, 2, 3 points from from that, and be able to deliver that information back to those who are listening to you. I think that is so key. I think that is so powerful. But at the same time, be willing. See, we get excited about what our message is, and we get excited about the spirit moving in our services, and we forget, or we're nervous that if we say something that may be a little status quo, that we may not get the response that we want. But at the end of the day, there is, and I'll say it often: if you touch one person by what you shared, then that is more than you've done without saying it. So you got to be willing to at least say something. You got to be willing to just open your mouth and say something. And trust me, I can tell Pastor Lador has a little fire behind him. And so I'm excited to partner with you. I'm excited to support all of the work that you're doing. Yes, sir. Yes, sir. Thank you so much.
Last question. I'm sorry.
Okay.
As you was just talking, how do I get to become proactive and not reactive? I feel like so many times members don't see the need for things until it hits close to home. And I've known somebody who's died of AIDS. I've watched them, like, as they've gone through the pains, being in the bed, having the bed sores and everything like that. And so there are a lot of people who may not have experienced that, but how do I get them to understand that just dealing with sexuality, dealing with HIV, dealing with all of that is something that we need to be proactive about in the church, and not reactive, not waiting until, because when you have to wait until it happens close to home, then in my opinion, you're too late,
Absolutely.
So how do I become proactive?
So I'll say it easily like this. 1 year ago, the world was faced with a global pandemic. And 1 year ago, we all had to immediately shift how we moved around in society. I'm at the desk. We had to start wearing these. These became our normal way of life. And I compare COVID-19 to HIV/AIDS pandemic because if we are constantly having conversations about it or saying you have to do this, you have to protect yourself, then I think making it a part of your normal conversation will make you more proactive versus reactive. Now, there are some people that, again, there's so much stigma that, you know, if the pastor decides to pass out condoms, that the pastor is now saying, go ahead and have sex. That's not what that's saying. That's saying, if in fact, what did 1 Corinthians 7:24 say? In whatever condition you are called. So that means that if you found yourself in that condition, then you have to make sure that you do whatever you need to do so that God can remain. I'm not preaching today. I'm gonna let the pastor preach a good word this morning.
Nah,
So,
nah.
so I,
That's a
I'm
word.
not
That's a
gonna do
word.
that.
That's a word.
I'm not going to do that, but we have to make sure that we keep in our mind that whatever condition we are, we want to make sure that God finds us there and is okay, and we're okay with that condition. So if that means, you know, every week or every having a prayer call every Tuesday morning specifically for this, that is shifting. That is being proactive. You know, we have to, the little things that we currently do in our lives, we just have to add this to it. And guess what? It's okay. It is perfectly okay to do that. Yep.
Mr. Goodman, thank you so much for your time. Thank you so much for educating us. And I greatly appreciate the fact that you said that you're willing to partner up. So I'm just going to ask if Alicia would be able to share that information so that I can have and utilize you as a resource for our church.
Absolutely.
God
And I
bless
have
you.
with it too. Yes. And thank you so much, Carrie, for saying when you talked about safe sex practices, we do. Linda Ording-Bauer from the Suffolk County Clinic, when I interviewed her, she gave me a bag of goodies that I will pass to my pastor. And when we don't really know when our in-person service, because we're currently doing just Zoom and, you know, streaming on our YouTube channel, but for when we get back in person, and definitely when we can be face to face with one another, there are resources that, in case we come across anybody, or when we are witnessing to other people, if we can just provide these resources with them. She gave me a goodie bag that, you know, talks about taking the PrEP test, little pouches that include some contraceptives, as well as buttons. I have one on right now. It says, ask me about PrEP. And, you know, because we had this webinar, because we had the pleasure to talk about so many different things, we do all have some knowledge on this issue. And so therefore we can go and talk to people and be like, hey, I do know a little bit about PrEP, or I know somebody else that knows more about it. Let me get you in contact with them. We have some pamphlets. Parts of the presentation that I spoke on, I got most of my information from this pamphlet, Living with HIV. This came out February 2021. So it's very recent, very current information on HIV in today's age. And like I said, I will be passing off this information to Pastor as well as my other church members, so that we all can become more informed and that we all would be able to showcase our knowledge on the situation. And like Pastor George has been saying, prepare a safe space and allow for people to come to us to have this conversation on sex and STDs, STIs. So now we are going to go into our Q&A session. The producers are informing me that we are looking into our chats right now. Do we have any questions from our live stream? If anyone wants to comment, any questions or any statement, anything that they want to point out, we will show it on the live stream right now, and we will answer them to the best of our ability. Okay, so we currently do not have any questions. I will be asking questions to our panelists. I'll be directing them to the panelists specifically, and then we will, get on with the program. This is a question directed to Pastor George and Carrie. What are the qualities a young person should look out for in someone they want to speak to about sex and sexuality? And I will make a banner.
Right. Okay. I think if you're looking for somebody, you need to, and I'm looking at it from the standpoint of us being a church. You have to think of somebody who's spiritual. You have to think of somebody who's confidential. And I think confidentiality is very, very important. Young people, they face many challenges in life. And you as a young person, you may be facing some challenges. You may be sexually active in church, but you want to talk to somebody about it. You don't want to talk to somebody, and then after you've spoken to that person in church, then what you've said to the individual is all over the place. Confidentiality is very, very important. So you're looking for somebody who's confidential. You look for somebody who you can trust. I've known of situations where young people have gone to leaders in the church, and they've spoken to them about the issues, the problems, sexual problems, and they're taken advantage of. You don't want that happening. So whoever you speak to in church, that person has to be somebody who's trustworthy. So spirituality, trustworthiness, confidentiality, those are important factors. And I guess you need to know your leaders in church so that you can approach the right person when you want to talk about those issues.
Beautiful.
Yeah, I agree as well. I think one thing that Pastor George said that was spot on was that trustworthiness. So you don't want to become a topic of the sermon. And so, having conversations to say, Pastor, I'm coming to you in confidence. I'm coming to you because this is something that I need to work through. And then if you have to say, I don't want this shared publicly, you might have to do that in order, because I've seen people share something with the pastor in confidence. and then the next time the pastor preached their sermon, then, it was brought up. They may not have said who said it or, divulge who the person was, but their scenario was used as a part of the sermon. And I've seen people leave the church because of that. And so that's super important, so that having that trustworthiness is super, super, super important.
Great. The next question is for Zachary. And the question is, are you seeing changes in HIV/AIDS numbers in relation to race, ethnicity, and age?
Yes. So, with PrEP, we're seeing like a lot of our younger people are using PrEP. I wish the older populations would be more likely to adapt to this. But also still a lot of the HIV positives that we're seeing tend to be 25 and over, 24 and over, in that age range. And when it comes to relation to race, yeah. So this is like a huge one, but the Black community and the Hispanic community, like they're getting hit the hardest right now, as well as the MSM community. And that's something that we really need to address. But thankfully, we're blessed to be in New York State, which we do receive a lot of funding towards HIV care, especially for women of color. My program has a grant for women of color where testing efforts only go in that direction, which is great. But once you leave New York State, you don't see this. Florida has extremely high numbers of those being diagnosed with HIV, and they don't have the money that we're getting from the state, and that's a huge thing. At the end of the day, everything comes back to money, right? Yeah, these are the populations that are definitely getting hit the hardest. And with PrEP coming into play and post-exposure prophylaxis, those are huge benefits for us and big things. But yeah.
Great. Awesome. And I guess we will take one more question to stick within our time. This question is directed towards Pastor George. How can we create a culture within our church? And I believe we have done it, we both stated earlier that Amazing Grace does this annually. We do talk about sex, and we are open with our youth about it. But how can we now, within other churches in the area, create a culture that establishes the church as a safe space for people living with HIV/AIDS, or experiencing sex, being in sex, and being active, and along those lines? Sorry.
I think social media now has made it possible for us to reach a wider audience than before. Just look at what we're doing today. We are able to meet so many more people at their homes. So you're not just confined to the church building,
Right.
where people would have to come into the church to hear your presentation. So I'm thinking that we can utilize social media to a larger extent, so that we can have those programs, invite other people to come in and join us and be part of that program that we're putting on, so that they can have the information that we're trying to disseminate and give out there. I think if people catch on to that idea of trying to reach out to young people and talking to them in a responsible way about sex and sexuality. If we, like you said, we're trying to move away from the status quo. Instead of things being the way it used to be, where you talk about sex in church and everybody's looking at you and wondering, what is he going to talk about? I think it's time that we get comfortable with the subject of sex and sexuality, because, as I said earlier, that's who we are. We are sexual beings. God created us as sexual beings. Sex is a gift that God has given. Unfortunately, it has been misused, it has been abused, and so we have that negative stigma attached to sex. So whenever we want to talk about it, people are reluctant. But I think we have an opportunity now, with all of what is going on in social media. If people can get to hear more about the subject, then we can take it beyond the four walls of our church and reach out to more people and reach them with the subject.
Thank you so much, Pastor George, for your answer. I believe that yes, we can utilize social media to our advantage, and definitely become more comfortable with an uncomfortable thing. And so thank you so much. And so now I will give the closing remarks for our program. We have reached the end of our webinar. And for those that are still on, we'd like to say thank you so much for being a part of our webinar from beginning to end. If you joined on at any point in time, we still want to say thank you for being on and being open to receiving this information as we talk more on sex and HIV/AIDS within the SDA Church. I would love to thank our panelists for coming on and speaking in their respective parts. Would like to thank Zachary Frost. Once again, he is the Allergy and Immunology Community Outreach Specialist of Northwell Health. We would like to thank Carrie Goodman he is the Program and Development Consultant of the Balm In Gilead Incorporated. And of course, we have to thank Corey Chisholm, the spokesperson for New York State's Health Department HIV Stops With Me campaign. I also would like to thank the co-presidents of Stony Brook University's Adventist Club on campus, our foundation AYM, Rose Merlene and Rashawn Davis. Thank you so much for coming on and asking questions to Pastor George. And of course, we would like to thank Pastor George, pastor of our church and speaker on what is sex, as well as Pastor Neville Lendor, pastor of Amazing Grace. And of course, I have to shout out the AY department of Amazing Grace. We all worked together to make sure that this program became a reality. So I have to definitely have to shout out Reagan Harrison and Kenny Andre Waldman for being a part of the program, for representing for our AY department in Amazing Grace. And of course, we have to shout out and thank Desmond Jenkins Sierra for coming on as well, representing the non-denominational Christian community and asking his lovely questions towards Corey, as we all got more information from every part of the program respectively. We do have a post survey that we are going to put in a chat. It's in the comment section. And it's a post survey for us to get a better understanding of what you've learned from the program. And if you would like to receive any more information on HIV/AIDS or anything else, please just fill out our post survey, and we will love to read your responses. We would love to receive them as we are going forward as Amazing Grace, providing events such as these to our community. And now I will ask for Pastor Neville Lendor to close us out in prayer.
Before I close this out in prayer, Jalicia, Scott, I just want to tell you how proud I am of you. I just also want to thank Kenny Andrew Wildman and Reagan Harrison for the excellent job that you guys have done. I mean, y'all had me in a meeting or two, but I mean, y'all were on point with, from the timeline to everything else, your organization skills, everything was so professionally done. To the panelists, I just want to thank you again on behalf of Amazing Grace. Thank you for everything that y'all have done to educate us and to make us better as a church. Let us bow our heads for prayer. Our Father and our God, we just want to thank you so much for just all the things that we have learned from Brother Carey, Brother Zach, and others that have participated on the panel as well. We pray, and Brother Chisholm, we just pray, Lord God, that your Holy Spirit will continue to bless them, continue to guide them in their work and all that they do, and not only just strengthening our church, but strengthening many more communities to come. Be with us, guide us, and help us not to part with anything other than we're trying to educate ourselves more, to be better people, to be better Christians, but to be more aware. In Jesus' name we pray. Amen.
Amen. Thank you so much, Pastor. And thank you to all once again for coming on to our live stream. Please join us. You can join us, Amazing Grace SDA Church. We have our Zoom meetings for Sabbath on Saturdays, starting at 11. And you can come on and fellowship with us as we provide services for children, and also an AY program in the afternoons. We once again, please take our post survey as Amazing Grace are providing more events like this to our communities and to the people around us. We really would appreciate your responses for the post survey. And once again, just thank you for coming on. We hope that you've benefited so much from it and that you will be able to spread this information with the people around you. God bless and have a great day.